I can confirm the government's position in this regard is unchanged. However, we continue to work with our stakeholders to improve the process. All travelers can start the TA process up to 30 days before their departure date. They can go online, fill out the form, upload the vaccination certificate, and pay $40. Applying for a TA early is strongly recommended. All travelers will initially receive a pending review response, and then later, an email is sent closer to their travel date, reminding them to upload their negative test result. The TA review is completed once the test is uploaded, and at that point, the traveler receives a final response. Residents who do not intend to upload a pre-arrival test will receive an approved TA based on their vaccination certificate, and they will be tested on arrival at the LF Wade International Airport. Cruise passengers with Norwegian, Royal Caribbean, and Carnival Cruise Lines, who are the majority of our cruise visitors, will get an approved TA based on their vaccination certificates. Their negative test result is checked at the pier when they board the ship, and they do not need to upload it. TAs are prioritized as follows: for air arrivals, by arrival date; for sea arrivals, by departure date. The Bermuda Travel Authorization is relatively easy to fill out. It helps to verify travelers' personal information and travel details, and more importantly, it confirms that travelers coming to Bermuda are not COVID positive. I cannot stress enough that we are still in a pandemic. There are still coronavirus-related hospitalizations. There are still outbreaks in our community, and we continue to see many travel-related cases. While most travelers do not have an issue with the TAs, we recognize that as much welcomed visitor arrivals increase, there are some challenges and delays causing anxiety for those affected travelers. We have found that most delays are with passengers applying at the last minute, some completing their TAs on the evening before their travel or whilst at the airport on the day of travel in hopes of receiving their TA approvals on short notice. Travelers can avoid being denied boarding by applying for their travel authorization at least 2 days prior to their departure date, but certainly not later than 24 hours before. Travel documents are reviewed daily between 8 a.m. and 8 p.m. Do not wait to apply for your travel authorization on the day of your travel. The commencement of the cruise ship season has considerably increased the volume of TA applications. We have worked with the Ministry of Transport and our cruise ship partners to develop an alternative that I mentioned earlier for the passengers' TAs. In addition, we have assisted in reviewing their communications with their guests to ensure smooth embarkations on the day of departure. And I would like to thank the transport colleagues for their support. Before I end, there are 3 things to remember about travel authorizations. They are there to protect our borders, to ensure we can catch any cases of COVID being imported, and this protects both our visitors and our residents. The TA scheme is vital to help fund the island's COVID-19 response. The TAs pay for the pandemic support that they provide, testing at the borders, return testing for visitors traveling to or through the United States, which is much cheaper than most countries charge for departure tests. It helps to pay for the case management for those who test positive and the associated administration. And the TA also captures information used by the Bermuda Tourism Authority and the Department of Immigration, as well as HM Customs. The Ministry of Health will continue to work to simplify the TA application. More improvements in the pipeline are already being made, and we collaborate daily with our partners and stakeholders to resolve any issues quickly. Thank you.
Thank you, Minister. And now we'll hear from Dr. Ayo.
Good morning, Bermuda. Thank you very much, honey. Not a lot to say, just to reiterate what the minister has pointed out, that in order for us to be able to manage the pandemic on island, and also to avoid importing dangerous strains of this virus, is vital to us that we are able to capture the information around people who are coming into this country. So it's important that visitors are vaccinated. and are tested before they come into this country. And those who are not able to be tested, are able to test them on arrival in Bermuda. That gives us a good idea of what we are dealing with. We still have anything between a third and half of all our active cases has been imported each time. So it's important that we keep our eyes on that. As the minister pointed out, the pandemic is not yet over. We're grateful now that we're seeing a lull in cases. Well, that's not particularly true. We're seeing a lull in deaths and admissions from this, and this is as a result of one, the high vaccination rates that we have been able to achieve as a country through all our collective efforts, and also the fairly high level of previous infection that we have on island. And secondly, have a lot more therapeutics on island at the moment. So there's monoclonal antibodies, there's oral antivirals, there's oxygen, and there's steroids for treating people who are infected in the hospital. And that means that the number of people ending up in hospital is low to start with, and those who eventually end up in hospital, thankfully, don't have to stay as long. But I will still have to point out that we are still seeing deaths on the average once every 2 or 3 weeks from this. So this is by no means over. So Bermuda, do your best to protect yourself against this virus by vaccinating, and we do have vaccines available on the island until the end of this month. So please do avail yourself of the opportunity, if you have not been vaccinated, to do that. And also maintain social distance as much as possible. If you are with people that are outside your household, it's always a good idea to wear masks, especially when you are indoors. So thank you, Bermuda.
Thank you, Dr. Ayo. Dr. Miller?
Good morning, Bermuda. I'll certainly echo the words of Dr. Ayo and the minister, and I would urge everyone to maintain a certain level of caution. Things have improved from the days when we had the Delta variant and the hospital was filled with patients and we had to create extra ICU space for intensive care. However, we have to recognize that there is still COVID overseas. There's a significant amount within our community, and as people interact, it's worthwhile having some caution. At the worst times, we were more than 100 staff off because of COVID, either through infection or exposure. At the present time, we're less than 50, but that is still of significance because the numbers don't give the full story. There are some areas where we have very few staff, and therefore, if you have individuals from those areas who are off, then it really pose a significant strain for the others, or it could put us in a position where we can't deliver the services to the level that we would like to deliver them. And it's important, as Dr. Ayo has pointed out, that vaccines are still available, and I would urge people to take the opportunity to have these vaccines. They certainly can call and make an appointment at the Department of Health clinic, and they can certainly get vaccines still, and I would urge them to get vaccines. And I have spoken to a few people who have belatedly decided to get vaccines, and that is very good news. Some of them did it because they have to travel, but whatever the reason is, it's still worthwhile that more people have it. Others would have said, well, why get the vaccine? Because if you have the vaccine, people could still get COVID. Well, the part I would like to say to them is that those who have the vaccine will be in a better position to have good defense and good immunity against the virus, and therefore are less likely to be severely ill as compared to those who don't have the vaccine. So that would not be an argument against not having it at all. So we'll certainly urge people to have the vaccines and to wear their mask, because not only does the mask work in reducing the spread of the coronavirus, but it also works in reducing the spread of other respiratory viruses. So there's that added benefit. And we have been accustomed to wearing masks. We will now travel to the United States and notice that a lot of people are not wearing those. In fact, some people, the moment they get on the plane, they take off their mask. I would not advise Bermudians to do that. My advice would be, let caution be the byword. As a population, we have done well. Bermudians have cooperated with public health guidelines, and I would still urge everyone to continue to cooperate with those guidelines. It has worked well for individuals, it has worked well for businesses, it has worked well for the churches and all the various social groups. And there's no good reason at this point in time to abandon practices that have worked well. Thank you very much.
Thank you, Dr. Miller. We have Fiona McWhorter here from the Royal Gazette who'd like to ask a few questions. Fiona?
Good morning. Can you hear me?
Yes, we can. Thank you.
Good. Apologies. I thought my camera was on, but it appears that it's not. Oh, hold on. I can do it. Got there. Thank you. Good morning, all, and thanks for having us this morning. Thank you for the update today. People will be pleased to hear that there are some changes being made to the travel authorization process. A couple of things we've heard about recently, certainly in House of Assembly last week. Wayne Keynes, who's a government MP and also the chairman of the Bermuda Tourism Authority, had said that part of the streamlining of the process would be that one form could be submitted for travellers travelling together, for example, a family. That's not been announced today. Can you tell us if and when that might happen, please?
Good morning, Fiona. How are you today? We are looking into that. We're utilizing technology to the best of our ability, things like artificial intelligence to help streamline the TA process. And we are also looking and hoping to be able to announce the full implementation of the family TA, which is the one that MP Keynes was speaking about, where you can upload all the details with respect to all members traveling at the same time. Likewise, we're looking at implementing a process that will allow for the frequent flyers to upload all of their details once and then just upload their respective arrival tests. So all of those are in the making, and we will be announcing them in very, very short order when that process has been completed.
Sure. You can't give a definite timeline at this point.
I cannot, but it's being worked on, and we anticipate that that is certainly a priority. So we would anticipate being able to advise members of the public in the soonest and short order that that process has been completed.
Grateful. Thank you very much.
Thank you, Fiona.
Similarly, Mr. Keynes spoke about people waiting in queues when they call the hotline for assistance, something that has been, I think, a point of concern for travellers who have come across problems with their TA forms. Is anything being done, or can anything be done to increase, for example, number of call handlers, or ways to streamline or make that process a bit more efficient?
Thank you, Fiona. We have been able to address that as well through use of technology, yet again, in addition to having more persons able to man the call lines, but we've also been able to utilize technology and have systems in place so that the handling of the calls is smooth. There's a lack of a clogging of the lines. Now I think the average wait time now has been greatly reduced. So we do have more capacity, as well as utilizing technology to allow for the phone system to be more handlers in the phone system to be less clogged. In addition to that, a number of the vast majority of persons we're calling were persons that were on the cruise ships. So the enhancements that we've made to that process, allowing them to upload their vaccination status and the checking of their test results when they get to port, has greatly reduced the volume of calls that we're seeing.
Sure. Thank you. And just this morning, the Bermuda Tourism Authority has issued a newsletter stating that travellers arriving to Bermuda by air can now submit their travel authorizations up to a month in advance. And it says beginning this month. Now, I was of the impression that up to a month in advance had actually started at least 7 weeks ago, back in April. Certainly, my understanding is that's what the government website had said at that time. Is that not the case?
That is the case, but what we found is that communication is key. And notwithstanding that was the case and that it was located on our website, we've taken more steps to encourage the BTA to also to their stakeholders and their travel partners and the visitors to help to reemphasize the messaging that, yes, you can upload your TA information up to 30 days in advance.
Sure. And you've mentioned obviously as well that for people who do upload early, they will get a pending approval, and then the approval comes, I think you said, within the final sort of 48 hours or so after those negative test results have been uploaded. What assurances can you give those travellers that they won't be waiting until that moment that they're at the airport or about to board, that final approval will come through in a timely manner?
Thank you, Fiona. As I've indicated previously, the vast majority of persons, and we process thousands and thousands of TAs a week, the vast majority of TAs are processed expeditiously, and there are minimal problems with respect to same. However, persons that are waiting until the last minute, we've seen many, many occasions, too numerous to particularize, where persons are literally at the airport trying to get a TA with a flight that's scheduled 2 hours in advance. So again, we're trying to encourage persons, in addition to uploading all the information as quickly as possible and as far out as possible, up to 30 days. However, because of the use of AI, like I indicated previously, when they upload the TA, AI will confirm the vaccination certificate. So the only thing that's actually waiting and pending is the uploading of the COVID test. So upon uploading the COVID test, again, minimal of 24 hours in advance, that information will be processed and the person will receive their TA.
Sure, thank you. And can you tell us, do you have any figures on how many people have actually been denied entry to the island, whether by air or by sea, because of incomplete or non-existent TA forms?
I don't have that information in front of me. However, what we do is we do work with individuals. So when an individual applies for a TA, obviously you would recognize that if they're a visitor to the island, then they are required to be immunized. So when a visitor applies for a TA, they receive the notification. If there's something inaccurate or incomplete, they receive an email that indicates this is what is pending and this is why it's pending. And it tells them you must upload this. It explains to them what is the issues. We've seen occasions sometimes where a person might upload just one copy of their vaccine certificate, which shows one dose, as opposed to the backside, which has both. So they receive an email that communicates to them what is missing so that they have time to rectify it. And again, applying in advance allows for the time to take place to address any issues that may have occurred with respect to uploading the incorrect information. Sometimes individuals might upload the vaccination certificate in the test results. So they'll receive an email to say, this is incorrect, please complete the process. But whatever is inaccurate or incomplete, they receive an email to notify them of that.
Sure, thank you. With regards to vaccinations and boosters, my understanding was that earlier, maybe a month or two ago, people eligible for, let's say, a fourth shot or a second booster, it was for those who were 65 years and older and immunocompromised. The guidance now appears to be that it's those for 50 years and older and immunocompromised. I just hoped you could provide some clarification on when that changed. Particularly, we've had people who within the past couple of weeks have been apparently applying for a fourth shot in that sort of 50 to 64 age bracket and have been rejected, although I know that the government website did say that it was available to that age group prior to yesterday or whenever we last had the information from yourselves?
Yes, you're correct. The government website did indicate that you could apply for the vaccination if you were 50 and above. We did announce it yesterday in our press conference. There are sufficient vaccinations that are available in Bermuda, as we've indicated previously. The current shipment that we have does expire at the end of June, so we are encouraging persons to become immunized. As well, we currently, thanks to the Bermuda Hospital Board, they've agreed again to assist us with respect to immunizations and distributing the vaccinations. Regrettably, right now, the Hamilton Health Clinic is closed for some services that are required. However, in the interim, the hospital board has agreed to help us with the immunization, and persons that have been waitlisted for taking the vaccination at the Hamilton Clinic are able to register online and get the vaccination through the hospital, and we will be announcing in short order when that will start. And the 50-year-olds plus, we did do a soft launch to make sure that the pharmacists were ready to assist us with respect to the immunization of 50-year-olds and so forth. And perhaps the CMO can speak a little bit further about the BACIP approval process. Thanks, Fiona.
Thank you.
Oh, thank you. So thank you, Minister. So the Bermuda Advisory Council on Immunization Practices had reviewed this sometime early in May, and looked at the evidence and reviewed our recommendations, which is basically to vaccinate everyone who's 50 and over with the second booster shots, and it also includes everybody who's 16 and over who is severely immunocompromised, and also all residents of long-term care facilities are included in this mix. So yes, that happened in earlier on in May, and as the minister rightly pointed out, we had been working with pharmacist colleagues and also doctors' offices to deliver this. So we have had Omni Health and Edgeware pediatric practices have been doctors' offices who've really led on this, and I want to thank them for what they've done, and as well as Somerset Pharmacy. They've really picked up the gauntlet and run with it and provided services to everybody. Unfortunately, as the minister pointed out, we've had issues with Hamilton Health Clinic. That means that we're not able to provide the level of services that we would have hoped to prepare, but the Bermuda Hospitals Board has stepped up to the plate, and as the Minister said, we'll be announcing the details very soon.
Thank you very much. And maybe with yourself, Dr. Oyinloye, can you give us any information on the variants we're seeing on island at the moment? Can you give us any details on sort of what's the dominant variant right now, for example?
Right, so we haven't been able to send, well, we have sent samples for typing, so deep typing, deep sequencing to the New York Genomics Center. We're expecting results very soon, but the most up-to-date figures we have is from March, and that showed us about half of the cases we sent to CALPHA in March showed us that we have the BA2 variant. I suspect that will still be the case, and we might be seeing some of the sub-variants of the BA2 on island once we get the deep sequencing results back from the New York Genomics Sequencing Center.
That's greatly appreciated. Thank you very much. And I think this one's for Dr. Miller. Dr. Miller, you mentioned that certain areas in the hospital perhaps were more affected by others in terms of resources, staff resources, with people affected by COVID-19, whether directly or as contacts. Can you give us an indication of what areas in particular are affected, please?
Yeah, for reasons of confidentiality, we can't name specific groups, because these are small groups, then the individuals would be easily identified and their identity. But some of these are important areas of clinical care delivery. And so we always have contingencies. but it just shows that COVID is no respecter of persons, and it is within the community, and our staff live within the community and interact with people in the community. So there's a constant reminder, not just to them, but to everyone else, as to how we are interconnected. And in fact, if we're not mindful of that and let our guards down, then it could pose a serious threat.
Sure. And for yourself, and the others may wish to speak to this as well, we've spoken for some time now about learning to live safely with COVID-19. In your opinion, do you feel like in general terms, residents of Bermuda are doing so?
I must congratulate the vast majority of Bermuda residents in that I go to the pet store, for instance, and I notice that they enforce the regulations and people are wearing their masks going in. The staff serving in the pet stores, they're wearing their masks. So that's an area that is good, and I must congratulate those businesses. There are some areas, however, where people are a little bit lax because it may be an element of ignorance from the point of view that I will see people sitting outside and they're sitting very close to each other, having lunch or having dinner, but they're having a jolly good old time and they're shouting and they're laughing. And that proximity, although in one sense it is in keeping with the rules, it's an area of risk that, I would just like to point out to people that when you're in that close proximity, faces touching with strangers and they laughing and shouting, it's the perfect opportunity for transmission. There are also some folks who would go to areas of places where they exercise, and it has been shown now conclusively, and in fact the BMJ referenced an article last week, that in instances where there's vigorous exercise and people are in close proximity, the amount of droplets that they put out can be as much as 500 or 700 times what would happen in normal breathing and conversation. And if the person were to be infected with COVID, then it becomes a perfect spreading opportunity. Although because they're outdoors, they may think, well, it's not going to happen, but you have to be mindful of proximities.
Thank you very much. That's appreciated. I don't know whether or not Minister or Chief Medical Officer wish to add anything to that.
I think Dr. Miller has captured it perfectly.
I appreciate it. Thank you. And then one last question, just with regards to the time of year we're in, lots of students returning from abroad and lots of people probably thinking about summer travel over the next few months. Any particular concerns on those elements? I don't know, we're going to be stepping up monitoring in any way. I know it's pretty comprehensive as it is for the travel authorization process.
Thanks, Fiona. As you said, the monitoring will continue. The travel authorization process does require visitors that arrive to the island to ensure that they're immunized, as well as have a pre-arrival test, and likewise for residents, if they are not having a pre-arrival test, then they will be required to test at the airport. So we need to continue to protect our borders, and notwithstanding that there will be students returning from home and quite a lot of travel and the like, we can just encourage individuals, as Dr. Miller said, to ensure that they continue their mask wearing, particularly when they're overseas. And we will need to ensure that we recommend that Bermudians continue to wear their masks indoors and as well when they're overseas. Thank you.
I appreciate it. Thank you all very much for your time this morning.
Thank you, Fiona. Thank you, Minister Wilson, Dr. Oyinloye, and Dr. Miller. That concludes today's press conference.
Thank you.
Thank you.